Surprise! Fortunately, not all surprises are good. In this episode of Healthcare Hacks, we're going to talk about surprise medical bills and what you and your family can do to avoid them. Hi, my name is John. I'm a healthcare hacker. Surprise medical bills, I really define them as when you get charged for something, even though you've got insurance, that you're not expecting. It's not your deductible, it's not your co-insurance, it's not your copay. It's something your insurance doesn't cover. I talk to a lot of people that say, John, I've got great insurance. I don't have to worry about surprise medical bills. And I say, you do. Unfortunately, you do. It doesn't matter how great of health insurance you have. Surprise medical bills can still happen. There's really two main causes. The first one is out of network. So you might go to a hospital that's in network, but a surgeon that does the surgery is out of network. Well, guess what? You're gonna have to pay more for that surgeon. And look, you're unconscious, can't decide where to go, you're taking an ambulance ride. There's no way to fully avoid it. But if possible, ask the question, is the surgeon in network? Is the anesthesiologist in network? Is physical therapy in network? That's a good way to avoid some of those medical bills where your insurance company will only pay a little bit and you'll be responsible for the entire out-of-network amount. What do you do if you do get that out-of-network bill? You negotiate it, is what I tell people. Because it doesn't go through your insurance. Basically, your insurance company says, we don't have a contract with you, you've got to pay the full charges. That puts the onus on you. Most organizations, most providers realize that they're charging you more than they need to. Typically, your insurance company will pay 40 to 60% of what the charges are. So what I tell people is look at what you can pay and try to shoot for the 40 to 60% of what the charges are. One other little piece of advice. You can also go on payment plans. Most providers will offer 12 to 24 months interest-free payment plans. So if you get that big bill, you can ask to basically protect yourself so you don't have to come up with the money right away and plan for it over the next year or two. The second way people get hit with surprise medical bills is when your insurance company denies something. They might say, this isn't medically necessary. You don't need that back surgery. You can't fully avoid this, but you can absolutely limit your exposure. And the way to limit is ask for something called a predetermination. Anytime you're gonna have an outpatient surgery, infusion therapy, or high dollar radiology tests like a CAT scan or an MRI, you should always ask for predetermination. That's where your doctor makes sure that that's going to be covered. They send your medical records and information to the insurance company to make sure that's going to be covered by the insurance company before you have the services. Because if you have that services and the insurance company says, no, John, you didn't need that, guess what? You're probably going to be financially responsible. In summary, make sure that your doctors are in network, ask the questions if you go to the hospital as much as possible. And secondly, if you can, on anything that's scheduled, try to get a predetermination. Even if they say they don't require prior authorization, it's different. Ask for that predetermination. Otherwise, you're rolling the dice and you might end up paying tens of thousands of dollars that you don't need to. If you have questions about how to save money or problems you're facing with healthcare dollars, email us on the address on the screen.